and I'm going to present a project that I have with Institute RTRK. I have to apologize a little bit because some of my parts of my presentation are going to overlap with the previous one, but I'm going to present those data from the point of a physician. Evolution is something inevitable, both for human race as for technology. As far as healthcare is concerned, we evolved from handwritten suggestions to typewritten reports, computer-generated reports, then computers turned into laptops, to notebooks, and nowadays it is very difficult to meet a modern physician without having a smartphone in their hands or at least somewhere nearby. It is not exactly evolution of healthcare, but the fact that more people have access to phones than to running water is something that cannot be disregarded. In that sense, we as physicians needed to adapt. And therefore, the term mHealth appeared. mHealth is the delivery of healthcare services via mobile communication devices. It has the potential to revolutionize affordable healthcare delivery by alleviating systemic pressure on the healthcare industry. There are several challenges that we are facing in healthcare. With the development of healthcare and increase in lifespan expectancy, we have a growing number of patients with chronic diseases like diabetes, cardiovascular diseases, asthma, urinary incontinence. On the other hand, national healthcare systems face increasing costs and serious financial and budgetary problems. Patients and even healthy people, on the other hand, became proactive and health conscious, and they seek individuals' personalized health care that should be provided to them despite the increased mobility of the patients, especially in Europe. In that sense, wouldn't it be nice to have the same level of health care while continuing to have a normal active life instead of being stranded at a hospital, to maintain a high quality of life despite of having a certain chronic disease, to have your health status monitored without having to go to a hospital, and for us physicians to be able to give patients the most efficient therapy and support they need. That is the dream. What are the goals of mHealth? To develop patient-centered healthcare delivery, to increase self-management of illnesses, to alleviate the systemic pressures on the healthcare industry, to reduce the number of hospital beds occupied, to enable remote monitoring and smart diagnosis, to improve disease management, and to improve compliance with certain treatment regimens. Why mHealth promises to be a good solution? Because it requires low network maintenance, it enables remote monitoring in rural areas, and the phones are almost always on, and carrying one became a part of a modern lifestyle. There are different types of mHealth technology. Tablets invaded our hospitals as they enable certain caregiver to be mobile throughout the hospital while continuing monitoring of the patient they're in charge of. There are different devices developed for smartphones, like the ones tracking ECG or pulse oximetry or heart rate, etc., and they are invading actually the healthcare system. And there are different mobile phone applications that enable taking track of the patient's blood pressure, giving advice both to patients and physicians how to react in certain medical emergencies, to track a bladder diary, for example. Then there are wearables that the previous speaker told us about, and there are implantables. On this picture, there are 6 that are very common and are completely medically approved, and they are for several years already in use, and that some of them are life-saving, like cardiac defibrillators or pacemakers, and the rest of them, like insulin pumps, cochlear implants, are actually improving the quality of life of the patients who are wearing them. In that sense, mHealth is key to consumer-driven healthcare, and that is exactly what we are trying to achieve at our institute. But in order to approximate my work to you, I have to talk a little bit about the things that I actually do. One of the things that I'm dealing with are voiding problems or voiding disturbances. Voiding is a very simple act that all of us perform several times throughout the day, but is it really simple? in order for a person to be able to empty his or her bladder at a socially convenient time and to be able to empty completely, there needs to be exact coordination between the brain, spinal cord, bladder, and external sphincter. And usually it is not that simple. There are several voiding disturbances, but I'm not going to talk about all of them. I'm going to talk about the three most common ones. This is dysfunctional voiding. That is something that encompasses discoordination of bladder muscle contraction and external sphincter relaxation. Another one is bedwetting. Any of you having children must have had that problem at least at some point in their lives. And there is urinary incontinence or involuntary loss of urine. Dysfunctional voiding is something that has been considered as a disease that is typical for children. It affects 7 to 12% of school-aged children, but recent research shows that children that had voiding disturbances turn into adults who still have voiding disturbances. And this is a problem that is important since it may result in permanent kidney damage and permanent disability of a patient. Bedwetting affects 15% of school-aged children. It does not have any effects of their health. It only affects their social life, since those children tend to avoid pajama parties, sleepovers, trips with peers, etc. And it is also an emotional and financial burden for their parents, since they have to deal with this problem, they have to visit the physicians. And there is urinary incontinence. It is considered a disease according to the World Health Organization. It is not a life-threatening condition, but it causes a very negative impact on daily living and costs in terms of productivity and health services. Just to give you the picture, there are 56 million European citizens that are affected by urinary incontinence, which represents a serious impairment to the quality of their professional and personal life. For all those people with voiding disturbances, we have to make a diagnosis. In order to start with diagnosis, first thing we do always is ask patients to keep track of their voiding habits. This is an example of a paper bladder diary that we use at our hospital, but there are different apps available for those patients when they can track on their phones the fluid intake and the voided volumes and the frequency of their voiding and completely their voiding habits. Unfortunately, none of those applications are adapted for children, which I'm interested in, nor are any of those applications in Serbian language. And for most of our older patients, it is highly inconvenient to to keep a bladder diary in English. Once we had an insight into bladder diary, the next diagnostic procedure we do is uroflowmetry. It is the volumetric flow rate of urine during urination. It is expressed as quantity of urine excreted in certain period of time per second. It is performed by urinating into a special urinal, toilet, or disposable device that has a measuring device built in. Now, diagnosis is usually made based on the findings of the uroflowmetry, but sometimes it is very difficult to discern what is a proper voiding disturbance that the patient has from the voiding disturbances caused by the presence of a stranger in a room where you're supposed to urinate in public. Therefore, all of us dealing with such a diagnostic procedure fantasized about a device that could do the same thing for us at their homes. And actually, that is exactly what happened. And such a device was presented at the biggest urology convention in Copenhagen this year in March. And it is a disposable device adapted for children, women, and men. And it is called HomeFlow. And it is truly, as they advertise it, Uroflowmetry reinvented. Once we made a diagnosis, we started with treatment. First step in treatment is called urotherapy. This encompasses time voiding, time fluid intake, and certain lifestyle changes. There are several devices, usually watches, available for sale for patients who need urotherapy that have incorporated alarms for both fluid intake and for urinating. But I was unable to find any phone applications that would do the same thing for the patients, and that is also something that I hope is going to change. If urotherapy doesn't give any results, we go to biofeedback therapy. When we talk about children and dysfunctional voiding, for those children, the problem is how to teach them to relax their pelvic floor muscles, because that is needed. They need to relax those muscles in order to void without any increased pressure and risk for their kidneys and other organs. So what we do is that we put electrodes on their pelvic floor muscles, and their electrical stimuli turn into movements of the fish on the screen. So what is happening is that the software is moving the jellyfishes up and down, up when the child is supposed to do the contraction of the pelvic floor muscles, and down when they're supposed to relax those muscles. Usually children come for 10 days, and they have daily those exercises. And after 10 days, what we do is we perform Uroflowmetry, when we track the activity of the pelvic floor muscle. And after 10 days, after children have realized a little bit how to put the fish down, we try to explain to them that they're supposed to sit on the toilet, put the fish down, and then void while keeping the fish down all the time. And children really like this kind of treatment because they perceive it as a video game that they're supposed to achieve the highest possible score. Now, when we come to adult patients and patients having urinary incontinence, they have another problem. Their pelvic floor muscles are weakened by age, by childbirth, by lack of exercise, so they are unable to control their external sphincter at the times of increased intra-abdominal pressure. For example, when they sneeze, when they cough, when they laugh, when they start to run. For those patients, pelvic floor muscle exercises are a long-known effective treatment. But the main difficulty is that you have a patient that you're explaining how to perform an exercise. And it's unlike when you're explaining someone how to do the push-ups, you can just do them and then the patient understands what to do. With those exercises, you keep explaining something, but you're never sure whether the patient understood how to perform those exercises, nor whether this patient is really willing to perform those exercises at home. Some of the patients that we included are comparing this like exercising at home, when one day they have better things to do, the other day they even more have better things to do. But when they come for biofeedback treatment, they compare it like going to a gym and having a personal trainer. And that is actually what we are doing right now. We are treating patients with urinary incontinence with biofeedback. For now, they have to come to our hospital, and they come for exercises. Then these women, mostly women, but also children and men, they tend to first learn how to make those contractions, and then they have set programs in which there is a certain time that they need to keep the contraction for, then a certain time they have to relax for, and they have to repeat that for several times. And they repeat that 12 weeks in a row. We are currently evaluating the effects of such a treatment, and we are also evaluating the interest for potential use of a mobile device. Our idea, and my dream actually, is to develop a device that would look something like this on the picture. A patient could buy a disposable unit with just electrodes that would go into something that you from IT know how it would look, that would turn that into something that would go on a phone. And with a combination of an application that a patient could download, they could do the exercises at home at whatever time is convenient for them, because for now they have to sort of make a schedule with a urotherapist that, for a time that is going to be convenient for all of them. In this case, they could perform anything at home, and then a report would go to a physician who was asking for this kind of treatment. And then we could analyze the quality of those contractions, the duration of those contractions, and the number of repetitions that the patient performed. Unfortunately, we're not the only ones with such an idea. There is currently a European Horizon project called Women Up. They have pretty much the same idea, the whole package that we thought of. They already thought of as well. Luckily for us, there are several drawbacks. Their device is going to be for women only, since it is going to incorporate an intravaginal probe. So men and children could not be treated with such a device. On the other hand, Not every woman is prepared to do the exercises while having a probe in her vagina. So we hope that there is going to be space for our device as well. Thank you for your attention.